Welcome to the One Core Repair. So keep in mind, over the last 20 years, we built this program for you. This is women post-abdominal surgery after 3 months, up to 40 years. So if you've been weakened in the core area or you've had abdominal surgery, then this program is going to work. And just keep in mind that we're going to take you through a journey, take you through a process, and we're going to give you cues to when you should transition to each phase of the program. But also keep in mind that we're all different. We all have different backgrounds, different life circumstances, and different challenges going on. So you may have to individualize the program a little bit as you go along, and we'll guide you through that entire process. To get started in this program, the first thing we want to do is we want to evaluate. We need to figure out where you're starting from so that we can see your progression and improvements as we go along. Now, the first evaluation I'm going to have you do is this really, really simple. What you're going to do is you're going to lay on a table, on a bed, somewhere firm, or even the floor. And I'm going to ask you to lift your head here in just a second. And when you lift your head, what you're going to do is we're going to try to feel when our core kicks in. Now, it's important. We want to focus on this lower abdominal area that is usually the area that's been traumatized through C-section, hysterectomies, or abdominal surgery. So I want you to find your belly button. And then you're going to move your fingers down about 2 inches below your belly button. And then you're going to take your other hand and you're going to move it 2 inches out towards your hips. And if you can feel your scar, where your scar is, then that's okay to put it there. Now, you've had a laparoscopy, or if you've had any other type of scope type surgeries, you might not feel the scar. That's okay. So this is the area that you want to be in. And now what you're going to do is you're going to lift your head slowly. And go ahead and go back down. Now, when you lift your head, what you're going to want to do is you're going to want to feel how quickly your core or your abs kick into your fingers. Now, the idea is that your core should kick in instantaneously before your head even leaves the pillow or leaves the floor. It should kick in. And I want you to evaluate how quickly it is. Now, you may have to push kind of firmly to feel this. So I'll go ahead and lift your head again and see how quickly it is. And then stop wherever that elevation is and kind of evaluate. Now, I know you can't quite tell exactly how high your head is off the floor, but evaluate how quickly it's kicking in. And as you go through the One Core Repair program, we're gonna find that this is gonna kick in right away. Now, keep this in mind. Think about this, is that your core should kick in every time your head moves forward. It should automatically kick in. You shouldn't have to think about it. It should be an automatic response. And when that happens, it protects your back. You're going to feel stronger. You're going to feel more confident. Your neck's going to have way less stress. Think about doing an abdominal exercise. And if you're trying to do a sit-up and your core doesn't kick in until your head's 3 or 4 inches off the floor, that means all that stress goes to your neck and your shoulders, and it's just going to stress you out and make you feel worse. So this is one of the evaluations that I'm going to have you do. The second evaluation I want you to do is I want you just to write down what are the things that are challenging. And now challenging is a very objective concept. So look at the things that you do in your day-to-day life that you feel that should be easier. And it could be picking your kids up. It could be putting water in the trunk of your car. It could be getting groceries. It could be getting out of bed in the morning. This could be standing up straight and having good posture. This could be maybe your pains. Write down where your pains are, where your aches at, where your tension is, where's all these things in your body. I want you to write those down and save that. Because as you go through the One Core Repair program, we're going to reflect back on that through each phase, and we're going to see you start to check things off those lists. As you strengthen your core, you'll strengthen your body. As you strengthen your body, things in your life get way, way simpler. So this is the evaluation. I want you to take a few minutes and do this evaluation, and then let's get ready for phase 1, and that's our core awareness phase, so that we can start to get a strong core. So thank you so much. Welcome again to the One Core Repair, and we are going to have lots of fun here in core activation. So we'll see you in phase 1. So welcome to phase 1 core awareness. I'm very excited for you to get started with this program. The first step that we need to take is we need to start improving the awareness of our core. And it's really important for us to understand that the brain-core connection, when you've had a traumatic injury or surgery or a weakness somewhere, if that brain isn't connecting properly, you're compensating through other muscles and causing undue stress on your neck, your shoulders, your backs, your hips, even your knees and your feet. And so we're going to start by creating this awareness so that you can start to engage and understand where your weakness is and how you can start to feel the changes and the differences. Now, phase 1 is going to be anywhere from 2 to 3 weeks long. And remember, all of us are at a different place in our life, going through different things in our life. So be patient, go through this phase at your own pace, and make sure that you do not move on too quickly trying to rush through the program. Now, also keep in mind, I'm encouraging you to do this every single day. It only takes you a few minutes to do. If you can do it every day, that would be optimal. But realistically, 3 to 5 times a week, do this phase one every 3 to 5 times a week. It'll take about 10 minutes. It shouldn't be too long. And then also take time to separate yourself from your busy lives and do this in a nice quiet area. Now, as we go through this introduction of phase one, I'm going to take you through all the exercises so that you can learn them and understand them, and it's going to have a high description. But I'm going to have another video right after this, just going to give you the movements of the core movements of phase one. So it's a much shorter, much more condensed. So once you understand and learn the movements, you then can just follow the second video, which will take you through the exercises in a very simple way, in a very quick way, so that you can get the very efficient time and very fast speed so you can get back to your busy lives. Let's get ready for phase one core awareness. All right, so let us begin. We're going to start out with phase one with this amazing exercise. It's just basically helping us practice a posterior pelvic tilt. Now, if you've done Pilates and yoga, you maybe have heard this before or tried this before. Now, for some of you, this may be very, very foreign feeling, but what we're going to do is we're going to do 10 times. We're just going to practice the motion of doing a posterior pelvic tilt. Now, when you're doing this, I want you to think of it as your pelvis as like a bucket, and you're going to be tilting the bucket and dumping the water up onto your rib cage. Each time that you roll your pelvis and flatten your back out, it's like tipping that bucket. So when you do this, you think about having a small grape in the small of your back, and you're going to be pressing your back into the floor or into a bed or some firm surface that you're on, and your butt should feel like it's rolling up. The key here is you don't want to lift your butt off the floor using your legs, and you don't want your head and shoulders to move much. You just want all the motion coming from your lower pelvis and your lower abdominal area. So we're going to practice 10 of these. So we're going to do a posterior pelvic tilt, and you're just going to rock back and forth slowly. If there's discomfort, don't go as far. Just go as far as you feel comfortable, and go ahead and roll your pelvis flat. Good. Flatten that back out. Good. And then let it go. And then again, roll your pelvis, flatten that back out, and then let it go. Now I want you to evaluate yourself. Just go ahead and continue. Are you lifting your hips up with your legs? Is your neck and your shoulder moving a lot? You really want to control and use the motion just in your lower core. Like I said, for some of you, this might be very, very unique, weird, uncomfortable, not feeling like you understand it. You will get better. I promise. We'll keep practicing. And so we're just going to practice that motion. You might feel light stretch in your back. That's okay. We're just going to continue that motion and show you how that we want to start to isolate this lower core area, to start to bring awareness that we have this area that's been traumatized, needs to be able to move independently, needs to feel free, and ultimately get stronger. So let's do 4 or 5 more. Just a nice little tilt. Remember, it's like a bucket, and as you tilt your pelvis is now the bucket's tilting and dumping that water out as you roll back. Good. And then back forward. Good. Let's do one more. Very good. Now we're going to move on to the next exercise. So that was just practicing the posterior pelvic tilt. All right, the first movement we're going to do is called posterior pelvic tilt, and we're going to do this in a holding pattern, and meaning that we're going to hold it for an 8 count. It's really important we hold it for the full 8 and we rest for the full 8, because that's how the brain and the neuromuscular system starts to connect. So if you're rushing through this, then it's not going to work nearly as well. So definitely take your time and make sure the 8 count matters each time you do this exercise. Now, what you're going to need is a block, a pillow, or maybe a rolled up towel. So if you don't have one of those, pause the video, go grab one, but you're going to put it between your knees. Now, it's really important when you put this between your knees is that your hips should feel comfortable. If you feel any kind of pinching, then either make the block bigger or the pillow bigger, or make it smaller so that's very, very, very comfortable. Also, when you hold this between your knees, you do not squeeze really that hard. It's a light enough squeeze just to hold it, and this actually will improve the movement that we're going to be doing. Now, the first part of this is that we're going to do that same posterior pelvic tilt, that same bucket feeling where you're going to flatten your back out. You're going to squeeze that little grape to the small of the back to the small of the floor that you're laying on, and you're going to be holding that for that 8 count. All right, so what we're going to do is we're going to do a posterior pelvic tilt. Go ahead and tilt your pelvis. You're going to hold your back flat to the floor, and we're going to do that 8 count. So this 4, 5, 6, 7, 8, and then go ahead and rest. And so as you rest, we're going to do the same 8 count. We want to make sure we rest. We don't want to overstimulate this. Okay, let's do one more. And go ahead and posterior pelvic tilt. You're going to flatten that back off. Good. Hold that grape down to the floor. And 3, and 2, and 1. go ahead and rest. Now, when you're doing this movement, it's really important that your brain, you're trying to focus on your lower core. And we're going to get to that a little bit more in depth in a second. So let's go ahead and do the posterior pelvic tilt again. Go ahead and flatten your back out. Good. Feel that bucket tilt. Hold that back flat and firm to the floor. And you're going to hold it for that full 8 seconds or that full 8 count. And 3, 2, 1. Go ahead and relax. Now, in your brain, I want you to start thinking about below your belly button, right above your pelvis bone. I want you to think about those cores, those muscles down there. Are they working or are they not working? Can you feel it? Can you not feel it? So go ahead and do your tilt. Good. Holding that grape down to the small of the back down into the floor. And you're going to hold that for 4, 3, 2, 1. Go ahead and relax. Full 8 seconds. All right, and 3, 2, 1. Posterior pelvic tilt, flatten that back out, hold it nice and firm. Thinking about, can you feel those lower cores? Do you feel the left side? Do you feel the right side? Do you feel anything down there? And we're gonna hold it for 3, 2, 1, and go ahead and relax. Now, when you do this exercise, we're going to do it for six reps, six cycles. Now, some people are like, what about my breathing? What should I do with my breathing? Right now, I don't want you to worry about your breathing. We're going to integrate that over time. But it's really important. If your brain's thinking about something else, it's not going to be thinking about what we need to focus on. So I don't want you to worry about your breathing. I don't want you to worry about many other things besides the fact is that lower core moving, and are you starting to feel some activity and engagement in that lower core? So the next exercise we're going to be integrating you into is going to help us give a higher awareness to the lower core area. For the next movement, what we're going to do is we're going to use what we call as proprioception. We're going to help bring awareness to the lower core so that you can start to feel it more. We're going to still use the same exercise, that posterior pelvic tilt. We're going to do 6 times for an 8 count, but this time we're going to bring our fingers involved. So what I want you to do is grab that trusty block, pillow, or towel, put it between your knees, and then you're going to take your fingers, you're going to go find your belly button, both hands, and you're going to slide it down about 2 inches, and then you're going to slide it out to the side about 2 inches. Now, really close, you should be feeling your scar or close to your scar. And then we're going to go back and do the posterior pelvic tilt. We're going to flatten that back out, and then we're going to hold it for that 8 count. And what I'm going to do is by using your fingers, you're going to start to feel more awareness to that lower core. So let's go ahead and do your posterior pelvic tilt and flatten that back out. You're going to hold it nice and strong, nice and firm for that 8 count. We got it 4, 3, 2, 1, and then go ahead and relax. Remember, we're going to relax that for that full 8 count also. It's really important we relax just as much as we do the movement so that the brain can start to become aware. And let's go ahead and do the nice posterior pelvic tilt. Flatten that back out. All right, we're going to hold that for that 8 count. We got 5, 4, 3, 2, 1. Go ahead and relax. Now, the idea here is with those fingers, you should start to feel like your core's kicking in. You should start to feel like you're feeling more awareness to that lower core. If not, you're going to start feeling that. So let's go ahead and do it again. Posterior pelvic tilt, flatten that back out. Holding it nice and firm, not overly aggressive, just nice and firm. You're going to hold that for that 8 count. And we got 4, 3, 2, good, 1. All right, go ahead and nice and relax. And ask yourself, are you able to feel a little bit more? You're starting to create a little bit more awareness to that area. All right, let's go and do a posterior pelvic tilt. Flatten that back out. Good, hold that nice and firm. Focus on your awareness. Mentally, I want you just to think about that lower core, where your fingers are at. Are you feeling those cores kick in? And 3, 2, 1. Go ahead and relax. All right, we got 2 more. Make sure we do the full rest. Your tendency to rush this is quite often, so nice and easy and take your time. Go ahead and do your posterior pelvic tilt. Flatten that back out, mentally focusing on where those fingers are, focusing on that core, focusing on the engagement. Can you feel the awareness starting to come to the lower abdominal area? And 3, 2, 1, and go ahead and relax. All right, we got 1 more. So this is part of our awareness. We're just really trying to bring more awareness to that below the belly button, to that lower core where those abs have been impacted and traumatized in some way. All right, last one, posterior pelvic tilt. You're going to hold it nice and firm, thinking about that grape in the small of your back, slightly pressing it down into the floor, the table, the bed, whatever you're on. You're going to hold that for 3 more seconds. 3, 2, 1, and go ahead and relax. So this ends that exercise. We're now going to take and we're going to start integrating this movement to start feeling more left and right side so you can understand it more. So this next movement is really, really cool because we're going to be able to tell, is the left or the right side of your lower core working better than the other side, or maybe more connected than the other side. And so what I'm going to have you do is I want you to find that belly button with your right hand, and then you're going to go down 2 inches, and then you're going to go to the left side towards your pelvis, and you're going to just feel your core right there. Then you're going to keep your left hand down on the floor, the bed, or wherever you're laying down at. And what we're going to do is we're going to do the posterior pelvic tilt. With that, we're then going to have you gently, I'm going to repeat this, gently press your left hand down into the floor, and we're going to see if you can feel the engagement on your left side. And I want you to remember this because we're going to compare it to the right. So go ahead and do your posterior pelvic tilt. We're going to hold that for that 8 count. You're going to gently press that left hand down into the floor, holding that for 5, 4, 3, 2, 1, and go ahead and relax. We're going to do 2 more of that, and I want you really just to see how you feel. What does it feel like? What's your brain connecting to? How do you feel that connection? Because we're going to be comparing that to the right side here momentarily. So go ahead and do your posterior. Press that back down. Gently press the left hand down. Gently again. Don't stress your back, your shoulder, your neck out. And then you're just going to focus on feeling that left side. I want you to kind of evaluate how you feel it, how connected it is, and can you feel it? In 3, 2, 1, go ahead and relax. Remember, this is the only thing I want you to focus on, so don't worry about your breathing, don't worry about anything else, just focus on this little core, quadrant of your core. And last one, go ahead, nice posterior pelvic tilt. Good, gently press down the left hand. We're going to hold that for that 8 count. And 4, 3, 2, 1, and go ahead and relax. All right, now we're going to switch hands. So you're going to bring your left hand up, find that belly button, bring it down 2 inches, and then over towards your right pelvis. There we go. Put your right hand down. Awesome. Let's go ahead and do your posterior pelvic tilt. Flatten that back out. Gently press your right hand down into that floor. Really gentle. We're going to hold it for that 8 count. And 4, 3, 2, 1, go ahead and relax. Now remember, the idea here is to compare that left to the right. Which one's more engaged? Which one do you feel more? Do you feel one more than the other? Go ahead and gently press down, posterior pelvic tilt, gently press that right hand down into the floor, and we're going to hold that for that 8 count. Just focusing on that right side, evaluating the left compared to the right. And 3, and 2, 1, go ahead and relax. Now we got one more on this side. Take a nice full 8 count and go ahead and do your pelvic tilt. Gently press your right hand down, focusing on that right side. And 4, 3, 2, 1, and go ahead and relax. Now what you're going to do is you're going to evaluate which one did you feel more engaged on, which one did you feel more aware of, and whatever one felt more disconnected, what I want you to do is we're going to then go back and we're just going to focus on that side. So whatever side felt disconnected, I want you to go ahead and put your fingers on that side. I want you to put that hand down. So this is the left quadrant here. And what we're going to do is we're going to do 6 sets of these, all right, 6 movement sets. So let's go ahead and do a posterior pelvic tilt. All right, gently press your hand down of whatever weak side it was or disconnected side, and you're going to hold that for that full 8 count. And 4, 3, 2, 1. Go ahead and relax. Now remember, it's really important we go through the full 8 count on, full 8 count off. If you're a little over, that's okay, but do not rush through this process. All right, go ahead and do a posterior pelvic tilt. Flatten that back out. Good, gently press down that weakened side. Hold that for that full 8 count. And 4, 3, 2, 1. Go ahead and relax. All right, take the full recovery. That was 2. We got 4 more on this side. Let's go ahead and do the posterior pelvic tilt. Tilting that back out, flatten it out nice and firmly. Good, gently press down that side, that arm. Holding that for that full 8 count. And 4, 3, 2, 1. Go ahead and relax. All right, we're halfway through. We got 3 more on that side. Hopefully you're starting to feel more of awareness. Hopefully you're starting to feel that connection start to connect. Let's go ahead and do that posterior pelvic tilt. Good, hold that. Gently press down that hand. We're gonna full 8 count, focusing on that side, and we got 3, 2, 1. Go ahead and relax. All right, couple more seconds, and go ahead and do a posterior pelvic tilt. We got 2 more. Gently press down that left side, or that's the weakened side, holding that for that full 8 count. And 3, 2, 1. Go ahead and relax. All right, let's do one more. You should start to feel like there's a level of balance, or it feels maybe more aware on this side as it did on the other side. Let's go ahead and do your posterior pelvic tilt. Good. Gently press down that side that felt weakness at the beginning. We're going to hold that for the full 8 count. And 4, 3, 2, 1. Go ahead and relax. So the idea here is for us to start to create awareness from that left to right. Also, which side's more connected. There's a lot of reasons, but I find that it can change for some people. Some people are dominant to have a weakness on one side, and that's okay. We just want to be aware of it so that we can start to correct it. All right, so this is the last exercise of phase one, creating that awareness. And so you know the exercise really, really well, so we'll just get right into it. So what we're going to do on this one is we're going to do a full posterior pelvic tilt. We're going to flatten that back out, and then you're going to draw your belly button in towards the small of your back. So you're basically going to suck your belly button in. Now, it's important, again, that you're not overly aggressive doing this. It's just a light pull in, and we want to mentally feel and focus down to that lower core. Now, if you still need to use your 2 fingers, feel free to do so, to kind of put your fingers down there to feel what's happening. If you can mentally feel the core kicking in without doing that, awesome. Remember, it's just about creating more awareness. So let's go ahead and do your full posterior pelvic tilt. All right, gonna hold that. We got the 8 count. Draw that belly button in toward the small of your back. So go ahead and suck that belly button in and hold that for the full 8 count. And 4, 3, 2, 1. Go ahead and relax. Now, if you're having a hard time, you feel like you're holding your breath, just take some time. This might take a little bit of practice. So go ahead and do your posterior pelvic tilt. Good. Nice and firm. Pull that belly button down into the small of your back. You're going to suck it in gentle, focusing on the lower core, trying to get more engagement in that lower core area. And 3, 2, 1. Go ahead and relax. Make sure we take the full 8 count, full recovery. Relax the core, relax your back, relax your belly. And go ahead and do the posterior pelvic tilt. Flatten your back out, nice and firm. Gently pull that belly button down into the small of your back. Remember, don't over squeeze those knees, just nice and easy, light squeeze in those knees. And 3, 2, 1, go ahead and relax. Same thing, make sure your shoulders relax, your neck's relaxed, nice and easy, just focus on that lower core. Go ahead and do your posterior pelvic tilt. Gently draw that belly button into the small of your back. You're gonna hold that for 4, 3, 2, 1, and then go ahead and relax. We got 2 more. And go ahead and do your posterior pelvic tilt. Flatten that back out, draw that belly button down. And hold it for 4, 3, 2, 1. Go ahead and relax. And we got 1 more. Take your time. Go ahead and do your posterior pelvic tilt. Nice and firm. Draw that belly button in. Hold that down. Holding it for 4, 3, 2, 1. Go ahead and relax. Now, this is the wrap up of core awareness. Remember, it's going to be usually anywhere from 2 to 3 weeks long. Ideally, do it every day. If you can't, 3 to 5 times a week is awesome. And just keep practice. The goal is awareness. As you do this, you're going to feel it more and more and more and more. And then when you're ready, you're going to go up to the next phase, phase 2. And at any time, if you need to adjust back, go back to this phase, you can do this at any time. If you ever feel like your body's overwhelmed or stressed and you just need to take some time for yourself, remember, go in a quiet space, do this movement. It will help ground you. It'll help bring awareness to your core, and you will feel better when you get up. So that's the wrap up of phase 1, core awareness, and looking forward to getting ready for phase 2.